Jefferson Area Board for Aging. My colleagues here, I've got lots of colleagues here, but Brooke there in the back waving, she does work in the insurance counseling department also. She's the coordinator of Medicare counseling. I'm the manager of, we get throw titles around, manager of Medicare counseling. I started working at JABA 10 years ago. In a couple more months, it'll be 10 years. And I'd lived in the community for quite a while, and I thought I knew what JABA did. And then I started working for JABA, and I realized I only knew part of what JABA did. There are all kinds of programs that JABA has to help people age well in our community. I always like to kind of highlight a few of them along the way. I was thinking about our JREX this morning. It'll come back.
Yeah, it'll come
there back. And this is a situation where you've got a loved one at home and you want to keep them at home and maybe not put them in a facility yet or so. They're not in a place there, but you need help. And so this is a place where they can go for the day. Sometimes people go 5 days a week while their loved ones work or so. And sometimes they're there for just a day or so a week to give a caretaker or respite, a chance to run some errands and do some things. It's a wonderful program. We have two of them, one here in Charlottesville at our building back on Hillsdale, and one out in Louisa at the Betty Queen Center. And I always think that that's one of those situations where you don't think about it until you need it, and then it's a wonderful resource to have in the community for that. You were mentioning, sir, you have a relative. Tim works at JABA. He is an ASC, an Adult Service Coordinator. They're the jack of all trades. They know all the programs that JABA has or that are in the community and resources that are there for people. As they age and they're maybe having trouble at their home with mobility or things like that, or it could be all kinds of different things. And they work really hard to help people get a better situation and be able to just have a better quality of life there. I respect the ASCs because they work very hard to get the ball down the field a few yards for people. It really makes a difference in people's lives. In insurance counseling, we throw long passes and get touchdowns in an hour meeting. So it's a whole different, ours is much easier in a sense of helping people than what the ASCs do. They work really hard to make sure that people's quality of life can be just a little better. So, but there are lots of different programs. I just highlight a couple of those. As you saw in here, our mission statement is that JABA's mission is to promote, establish, and preserve sustainable communities for healthy aging that benefits adults and families of all ages. And I always think about that as and their families too. We have caregiver support groups that meet, and I find those as wonderful things. I go to them occasionally to talk a little bit about insurance, Medicare and other things, but I'm always amazed that that community resource of just gathering together. Someone will say, oh yeah, we've been dealing with this, and then you got 3 other people will go, oh yeah, we dealt with this, and here's the resources we had. And I'm like, oh, it's so wonderful that they have this, and all we do is facilitate them. It's really the people that are in those meetings that help each other out. So let's get on to the insurance counseling program. Our mandate, our core thing is to help people with Medicare. She might be trying to find us. So we're part of this federal program called SHIP, State Health Insurance and Assistance Program. They lost the A in the acronym somehow. But it's there to put boots on the ground to provide advice and counseling that's unbiased. Because when it comes to Medicare, there are people who will want to talk to you who are very biased in what they want to say because they're going to make some money off of this. Our program does not. We're here, and the federal government provides this because they know it's a confusing, complicated program that people need help with, and And I always say this, when people start Medicare, they're used to having an HR department or human resources or so telling them, here's what the insurances we're offering to you, and here's what your options are, and we can explain these options. When you retire and you go onto Medicare, you become your own HR department, and you have no training or experience doing this. And so it does make it a little more complicated for things. So when this comes down to the state level, it's VICAP, Virginia Insurance Counseling and Assistance Program. They did find the A and put it back in. And then on the local level, every AAA, Area Agency on Aging, excuse me. Every area agency on aging has a, see if it'll work now, there we go, has a manifestation. So there's a counterpart to me and our team in every district around the state and every district around the country. Now, JABA has really decided that this is very important. So we take the funding we get from those federal and state government and even local government agencies, but then we find other donors and things. And so we've built a very big and robust program, and we get a lot of support in the community because they see the value in this. But just know that what we call an insurance counseling program because at various times over its history, we've ventured out into other things besides Medicare, and then we named it that. So that it was all encompassing of that. And now we're back to our core mandate of Medicare, but the marketing department tells me I can't change the name because everybody knows us already as insurance counseling. So about various like, yep. So what we do is we provide free, unbiased Medicare counseling, and it's done by volunteers who are highly trained, and they are certified through those programs to be able to do this. When I say highly trained, most full Medicare counselors, their training process is 12 months to be able to sit down with a client on their own. And then we have like parts of where we teach some counselors just parts of Medicare, and even that's like a 15-hour training period just to learn one sliver of Medicare. So they are highly trained. They know what they're talking about when they sit down with you. And they're all volunteers. So they're not, they're not trying to sell you anything. They're not trying to steer you in one way that would make anybody any money or anything. They're just there to help in the community, and they see that value and put in that amount of time and training and effort so that they're there for you. And I have 50 of them. And we're getting ready to train a new crew, the new newbie batch, and there's about 20 of them going to be training this fall. So that's a lot of volunteers that are there in this program in our community for you. Where there's kind of, if you think about it, there's three things we do. One, we help people when they're setting up their Medicare. When they're first starting out, whether that's when they turn 65 or when they retire, or if maybe they've been on disability for 24 months getting SSDI checks, they could be 35 years old and going on to Medicare. But how you set your Medicare up in the first place is very important because some things you can't change down the line. And so, or at least it's not easy to change them down the line. Then we, as people are on Medicare, we help them when they have questions about it. When they have billing questions, they have different problems understanding what's going on with Medicare, or they've got to file an appeal or something. We are there to help them with that. And then the last one is that Medicare has an open enrollment season every fall, October 15th to December 7th. And we're going to talk about that a little later, but it's a very important time, but that's our busy time. We will see 2/3 of our clients in that 7 weeks in a year. And so we'll hit that, but that's really what we, if we had to sum it up, what we do to help people along the way. So let's talk about Medicare for a second. As I said, this is a national health insurance program. It has so many different parts to it and so many different ways of going about it that what's available to you, what the best options are, depend on your situation, but it also depends on where you live. really boils down to your zip code. But the answers for what might be right for somebody in North Carolina is vastly different than here. Or if they're out in Texas or Wyoming or something, it's going to be vastly different. If someone calls us and says, hey, I'm moving to Florida, I go, great, let me get my counterpart in Florida and you can talk with them. And if someone's moving here from South Carolina, it's like, yeah, talk to us about it, don't talk to somebody in South Carolina. And we also tell people, it's like, and this is why when you're trying to figure out what to do with your Medicare, don't listen to your cousin in New Jersey, because they don't live here and their situation is vastly different. Why it's that complicated and why it's that, I can't exactly, well, I kind of know whys, but it doesn't make sense that it should be that way. So it's very important that you talk to somebody locally about who knows the situation on the ground here when it comes to your Medicare. So, there are two paths, general paths for Medicare. One's original Medicare and one's Medicare Advantage. They're vastly different from each other. Original Medicare is made up of its pieces and parts. A is hospitalization insurance, or as we like to call it, your hotel stay at the hospital, because it pays for you to be in the hospital, to the nurse there, and the food, and the bed, and all that. And then Part B is the medical part. It's the workhorse, it's the doctors, it's the tests, it's the therapy, it's the surgeries in the hospital, and the doctors in the hospital, and everything. So it's the workhorse for that. For most people, A is free because you paid into your FICA for 40 quarters, 10 years, so A is free. B now costs $185. And then, if you think about it in very general terms, A and B, they pay 80% of the bill. And you're responsible for 20% of the bill. And on original Medicare, there's no out-of-pocket maximum. So it just keeps going. You owe 20% of infinity. So there's no cap on that at all. And you could have very, very big bills if all you had was A and B. Now, a Medigap is also known as a Medicare supplement policy. It's through a private insurance, and it's picking up the 20% in very general terms. There's some details and some specifics, but it's picking up the 20%. The only thing, like for people going on to Medicare nowadays, the only thing you would have to pay for would be that Part B has a deductible of $257 for the year, per incident for the year. And then you get Part D is your prescription insurance. It's separate because it was added into Medicare much later, and that's through a private insurance company, but it's regulated very heavily by Medicare for that. Now, a Medicare Advantage plan is you take everything here and you wrap it up and you hand it over to a private insurance company to manage your health insurance. And that means that it works a lot like your employer health insurance would, where there's co-pays and deductibles and things that go along with it. In fact, it's a private insurance company. You still have to have your A and B and pay for B, but now you've got provider networks involved. You've got what doctors are in network and not in network. You have co-pays, co-insurances. It does have an out-of-pocket maximum that you would pay for the year, and it offers extras, things like dental or vision or hearing aids or so. Now, we go back to what I said early off here, which was different places in the country, different zip codes, Medicare is a little different. There are places in the country that have great Medicare Advantage plans, and they work well when you try to use them. And there's other parts of the country that don't have as good Medicare Advantage plans, and they don't work well when you try to use them. Virginia is in that second category. I get way too many people come to me and said, I like my Medicare Advantage plan until I tried to use it. And I was like, oh, that's not good insurance. That's not helpful at all. Now, there is a big variety here too, because there are the Medicare Advantage plans that any individual could go out and purchase. And that's what I'm talking about when I say ours are not quite as good and are a little more difficult when you try to use them. However, some people around this area are given a Medicare Advantage plan through their former employer. And so now it's more like a nationwide insurance thing, and those ones work pretty well. But if you have to go out on your own and buy one independently, you want to do it with your eyes open. I say things like how they when you try to use them, they don't necessarily, there's problems with them. Like California, if the denial rate, like when they go to pre-authorize something, the denial rate in California on Medicare Advantage plans is under 1%. In Virginia, it's over 9%. And it's always on, usually 9%, they deny 9% or more. And it's always on the important and expensive things. In fact, Medicare Advantage insurance companies are nationwide getting into trouble for the denial rates that they have for these. This is not something you want to find out when you're sitting in the ER and the doctor is saying, I want to run this, we need to do this procedure, to find out that one, your insurance company is going to take a while to pre-approve it, and two, they're not going to when it's, yeah. Over on original Medicare, you have a lot more certainty of coverage. There's not a lot of pre-authorization process or anything. You walk into the doctor's office and the doctor says, hey, I think we should run this test. Your only question is, does Medicare cover it? Because if Medicare covers it, it's right there in the book. He doesn't have to ask pre-authorization on that for almost anything. There's a few things he might have to, but
right.
And if Medicare covers it, your supplement will cover it, no questions asked. So your supplement, even though it's through a private insurance company, gets no say in your medical care. They just pay the bill. That's all they do. Over here, on the Advantage plan, the company gets to decide on your medical coverage. So you have less certainty of coverage over on this side. It's not a straight answer to say everybody should be on one side or the other, because everybody's situation's a little different. I've got people who are under pretty low income and just can't afford the premiums over on a Medicare, original Medicare for a supplement. So they might be over here. But I do know most people in our area are on original Medicare, and very few are on this. Now the number has gone up over the last 3 years because the advertisement and the pressure that you get from salespeople has exponentially gone up. Because that salesperson might make $100 selling you a, let's see, I'm going to back up a couple of slides here till I get this. They'll make about $100 selling you a Medigap policy. They'll make about $800 selling you an Advantage plan. And if they can keep you on the Advantage plan, they'll make another $300. But as an individual who's not a federal employee, getting back and forth, getting from that side to this side is easy. Getting from this side to that side is hard. And so, so Medicare A and B, Medicare A and B, you would have to have for both sides. But a Medigap you buy through a private insurance company, about 40 different companies will sell you those in the area. A 65-year-old in our area will usually start just around $100 a month. Now, here's what happens when you're on original Medicare. Remember I mentioned there's a $257 deductible for Part B. So it's Saturday night, your left arm has gone numb and your chest is hurting and you're going, wow, should I call the ambulance or not? You call the ambulance, they take you down to the ER. The ER runs a battery test on you. Then they wheel you upstairs for 2 days to decide what to do. Then they decide, well, we're going to have surgery. You have surgery, then you go over to like Encompass or something to rehab for a week before you can go home. Now you have physical therapy for the next 6 months. Your bill, $257. Over on an Advantage plan, going to be thousands of dollars. Vastly different. What it gives you over there is the security of knowing that calling that ambulance in the first place wasn't a financial decision. It was just a health decision.
So once you reach that 257, everything is covered?
Everything's covered. Yeah. There are very few things that are not covered by Medicare, but I had one of our counselors who's doing great now, but before the pandemic, he had a bad spring where he had a couple of heart attacks, a couple of surgeries, 3 hospital stays, all in a couple of months. But he's doing great now. And so, but he jokes with me, he goes, yeah, I paid $35 for a cough syrup that wasn't covered. So, you know, that's what we're talking about, the differences here. So there are vastly different paths to going on Medicare. But as I said, there's a lot of pressure by salespeople to push this. We had a client who came in who had just signed up for this. Her and her husband had just signed up for this. They had original Medicare, but they hadn't gotten rid of their pieces over there yet. So when they came in to see us, just a couple of days after they, you know, talked to the salesperson about this, we were able to, because of the time of the year, unravel it and put them right back over the other side. We did that for her, and then we were working on him. Within 5 minutes of hitting the button on Medicare to get her back to that size, her cell phone rang, and it was the salesperson saying, I see that you canceled your Medicare Advantage plan, you don't want to do that. And he was trying to, because he was going to lose $300 if she got off of that. But that's how aggressive they are with sales pitches. And so, we tell people is like, if you're thinking about changing something on your Medicare, just take a beat and talk with one of the volunteer counselors to talk it through to see if it's the right thing to do. So, Winter, what's your phrase you came up for us with us?
Skip the sales pitch, get the facts.
Skip the sales pitch, get the facts. So let's talk about just a couple of other details here. One, I'm going to hit this kind of real quick, but there are people who are on Medicaid, which is a state health insurance for people with low income. And when, let's say, they turn 65, they would be on both Medicare and Medicaid also. So Medicare would be their primary, Medicaid would work as their supplement. They would have a setup with their original Medicare card, and in Virginia, the Medicaid's a Cardinal Care card. But they still have to have a prescription plan. Because even though Medicaid covers prescriptions, once you go on to Medicare, it no longer covers the things at your pharmacy. So you have to have a prescription plan. I'm just buzzing through this real quick there. So, because I know that there are people who get confused with that. They go, well, I was on Medicaid, my prescriptions were covered, now I'm dual eligible, I'm Medicare and Medicaid, and they don't bother to get a prescription plan, then they rudely find out that their prescriptions aren't covered. So, why it has to be this complicated, I don't know, but it is. So, prescription insurance through Medicare is a separate card you have if you're on original Medicare. If you're on Medicare Advantage, it's wrapped into your Medicare Advantage plan. But there's been a lot of changes over the last couple of years with it. One, what you knew of the donut hole and how that all went away on January 1 of this year. So now the phases are just, you have a deductible period, then your initial coverage period, and then you have a $2,000 cap. So once you've paid in $2,000 at the pharmacy for your medications, you won't pay any more for the rest of the year for your prescriptions, which for people who are on high-tier drugs, this is very important. As I say, if you see a drug on TV, it's expensive. So if you're on a couple of those, you're going to hit the $2,000 cap in the year. Now, let me go back to that deductible thing too, because they should have used a different word than deductible. It doesn't mean deductible like you and I know deductible. They should have used something like modified deductible or something. Because a deductible would be you pay retail price until you get to the deductible amount, let's say $545 or so, and then you're going to then pay what the negotiated rate is. However, that only applies to high-tier drugs. Tier 3, Tier 4 or above, you would pay retail price for them until you hit that point, and then you would have that. But your lower tier drugs, your maintenance drugs that you're on, everyday drugs that you're on that might be maintenance, levothyroxine, metformin, whatever, they're low tier drugs. So though they may cost you $1 or so, that dollar goes against your deductible, but after deductible, it still costs you $1 because that's the negotiated rate. So you're not paying the retail price for your low tier drugs. It's very confusing, but people get caught up on the deductible. Why I don't want to have a high deductible. I go, it doesn't even affect you because all your drugs are low tier. So, but this was a new thing. This came in January 1, this $2,000 cap. There's some caveats with it. One, the drug, to reach the $2,000, the drugs have to be on the formulary of that plan. They have to be covered by that insurance. If it's not, then it doesn't count towards the $2,000. You have to use an in-network pharmacy, not a problem necessarily for our area, because even the mom and pops are usually in networks on most plans. And so, but this was a game changer for a lot of people who are on cancer drugs or so like that. It really helped them out this year. So that was a big change with that. Also, we're talking about prescription drugs. I'd mentioned earlier open enrollment. If you are on Medicare already, you're an exception to everything. But if you're on Medicare already, open enrollment is very important. Every October 15th and December 7th, you have choices, and it really has to do with the Part D if you're on that side, or your Medicare Advantage on this side. Doesn't have to do with the other parts, it's just these. Let's use Part D as an example. Every prescription insurance plan on January 1 changes everything about them. How much the premium is, what drugs are covered, which ones are not, how much each drug is at each pharmacy. That all changes. So I get people who say to me, I say, I like my prescription plan this year, I'm just going to keep it for next year. And I go, not actually an option. You get next year's version of that plan, and that could be completely different than this year's version of it. So what we do, you sit down with the counselor, we put your drugs into the Medicare website, we put your pharmacies in, and then it kicks out and says, what's the best plan for you, given the premiums and how much the drugs are at the pharmacy you use. So, 50% of the people that we see any year in open enrollment, next year's version of their plan is the best option. Great. 50%, it is not the best option, and sometimes by a long shot, it's not the best option. So every open enrollment, it's basically a coin flip to see whether or not the plan that you're on this year is the one you should stay on for next year. And when I say 50-50, I don't mean 49-51. It somehow always comes up 50-50 for it. So it is really it. Last year, we saw 2,937 people in the 7 weeks of open enrollment. And we were able, that 50% of those people needed to change plans. We hit the enroll button. It all changed in the Medicare system. Medicare takes care of canceling the old plan and getting you the new plan signed up. All you have to do when you walk out of the appointment is wait for the cards to come, and those are the cards you'll start using on January 1. So it's pretty simple process. Now we're able to go, well, if you didn't change plans, here's how much money your premiums and your prescriptions were going to be. And now that we've changed plans, it's going to be about this much. We subtract one from the other, and we go, that's how much money we saved. So 2,937 clients, half of them changed. We saved them a little over $4 million. So open enrollment is very important every year because you have no idea whether or not that your plan is going to be the right plan for next year. Again, you're your own separate thing. People who are on Medicare Advantage plans, it's not just the prescriptions that we're worried about, but it's also, is your doctor still going to be in network next year? So we have to look at those things, and your specialist or so. So, you know, we go through a little more detail with them, and they may need to change plans also during open enrollment to start at the first of the year. So do not ignore open enrollment. We have lots of counselors who want to help you with it, and will sit down and gladly do that with you. We do counseling in person, but we also do counseling via Zoom. And so whatever works best for you, convenient for you, then we can set you up for an appointment with that. We had a big meeting yesterday, we're getting ourselves ready. We'll probably start scheduling those appointments. We have a waiting list already of people going, I want an open enrollment thing. So we'll have our scheduler together for the October 15th to December 7th in a few weeks, and we'll start calling people back and scheduling those appointments. So any questions about that? Sometimes that's a surprise for people. Sometimes people go, oh, I know that. I do that all the time. Yeah, so.
But you have the correct information for what's going to change.
Yeah,
January
Medicare
1st.
gives us that on October 1st. And so then, because we're using the Medicare.gov website. And the insurance companies have to have all the data to them about the changes by the mid-August, so about now. So, and then they're going to get them all set up. Yeah. Very rarely is there a difference of more than maybe a penny or so than what the Medicare site says. But it happens occasionally, but there are some situations. But yes?
So the Medigap is not automatically enrolled when you...
When you have a Medigap, that will continue on as long as you pay your premium, which is actually really interesting. But is that the only way, once you've signed up for a Medigap policy, the only way they can get rid of you is if you forget to pay your premium. So we tell people put that on auto pay. It's like my counselor friend who had a couple of heart attacks. He also jokes with me and says, my insurance company's never making their money back off me, no matter how long I live, because they can't get rid of him. And they're not going to raise his rate based on how much he's cost them. They can only raise his rate every year by his age and everybody else's age. So they all go up the same on that. When you first started Medicare, you started Medicare Part B, you had 6 months under what's called a guaranteed issue right to get a Medigap policy. That meant that every one of those insurance companies has to take you. They have to give you their best price for your age, zip code, or male or female. And they can't ask you any medical history questions except you use tobacco. So I could have two people that say they're 65, they're both male, they both live in the same zip code, and one of them can run a marathon, and the other one has cancer and has had 3 heart attacks in the last year. Every company has to take them, and they have to take them at their best price. And once they're in, they're in. And every year, their premium is going to creep up by their age. 3.5%, 4% on average, some years more, some years less, but it's going to creep up. But it's going to creep up the same. So 10 years down the road, they're still paying the same amount comparatively to each other. So that's great. Now, that leads me right into my next slide. Because on July 1st, Virginia had a new law go into effect. It's called the Medigap birthday rule. Because before, once you were in and you were past your 6 months of starting Part B, if you tried to change plans, you had to pass medical underwriting for a company to take you. But now, on your birthday, you get a 60-day window where you can shop to see if you can get a better price for your Medigap with a different company or so, or even the same company. and they can't ask you any medical history questions. So now you have the opportunity to shop to see if you have a better price. Because the interesting thing about Medigap policies are, they're not complicated. They're not like, in a sense, you're thinking health insurance with all the details and things. A Medigap policy does one thing and one thing only. It pays the bill Medicare sends them. I've been doing this 10 years. No one has ever come back to me and said my Medigap didn't pay their part of the bill. Doesn't matter what company it is. So, all you're looking for in a Medigap policy, is what's the lowest price for the premium. That's all you're looking for. It's the one time in your life where everything we've learned about buying insurance goes out the window. We don't, when I buy my car insurance, my homeowner's insurance, I'm concerned about what company I have it with. What's the customer service like? What's their, ratings as far as how well that they cover things, and, and denial rates and all that. None of that matters on a Medigap policy because they get the bill from Medicare, they pay the bill from Medicare, period. It's done. And so now on your birthday, you can go shopping for any company that will give you a better price than the one you currently have. There's a couple of caveats. One is that you do have to stay with the same letter. Medigap policies are lettered. A lot of people nowadays have G's. Older people might have F's. Some people have M's. But you have to stay on the same letter plan. That's the biggest, that really is the only thing that is the caveat. So if you're on a G plan, you can shop for another G plan. If you're on an F plan, you can't shop for a G plan. So you got to stay on the same level. That's it. It's brand new. We have clients that have been doing this. We're only 6 weeks into this new law, so we're seeing how well it works out. But so far, so good. So there is, and this is good for anybody, but especially people on Medicare. Is you got to be cautious about scams and frauds and false billing and things like that going on. There's a lot of different things that happen. You get calls or contacted about getting free medical equipment through Medicare, and you do everything they say. They charge Medicare. You never get the equipment. It's a scam. Or so. Genetic testing was a big one for a while. It's kind of petered off. The Medicare card scam is a big one. You'll get calls saying, hey, have you gotten your new Medicare card? Your old Medicare card won't work anymore. We need some personal information now to make sure. And they're saying they're from Medicare. It's like, okay. So, I got to give them all this information so I get my new Medicare card. Medicare will never call you. Social Security will never call you. The IRS will never call you. And I do talks all the time, and I get somebody comes up to me afterwards, well, Medicare called me last week. I'm like, no, they didn't. No, they didn't. Some scammer called you last week. And you get a lot of misleading marketing, especially around Medicare Advantage plans. Again, you're not that. Not you, but everybody else will get a lot of misleading marketing. We see TV commercials for these great Medicare Advantage plans that are available to someone in Phoenix. And they says, call to see if available in your area. They just want to get you on the phone so they can sell you whatever they've got here, but it's not the plan they're advertising. So it's you got to be a little careful with those things. We work very closely with Senior Medicare Patrol. It's a federal program. Our state office in Richmond is really good, and they work with the FBI and other places when they're notified about scams or frauds, things going on. And so I made sure in your booklet you had their number in case something comes up, or we can help contact them for you. We always say guard your Medicare card like your Social Security number. You can review your Medicare summary notices. And this has maybe less to do with fraud or scam or just mistakes. People will get their Medicare summary notice and they'll see, well, I didn't have an MRI, or something like that. And 8 out of 10 times it's because something got miscoded. When they're typing it in, got miscoded. I had one of my own counselors saying, I got a $4,000 bill just a couple months ago. from UVA, and that should have been covered. And I go, that probably was miscode. Call the billing office, have them check the numbers. She called back 2 days later and said, yep, that was the problem. So, it's good to review that. Always be cautious about free offers. Don't share your personal information, and we can report suspicious activity to S&P or to us. The biggest advice I give to people, especially when I'm talking to older crowds, I go, look, when your phone rings and it doesn't come up as somebody in your contact list, don't answer it. I don't answer it if it's doesn't come up in my contact list. So that's the simplest way to avoid scams and frauds is just don't answer the phone when it's not somebody you know. If it's somebody that you do know and it's important, they'll leave a message and you can listen to it. And you get people in there like, oh yeah. It's like, stop it. And we get children of older adults who call or talk to us all the time and like, we're like at the level where we got to take her phone away from her. It's just stop answering the phone. So that's what I advise people there. The biggest thing I want you to take away from the talk is that we're here to help you. We're here to answer questions. Sometimes the questions are, okay, we're going to sit down, we're going to have a whole appointment, we're going to walk through this, get a game plan together for you, because the right answers for one person might not be the same answers for the next person given their situation. Like you're your own little thing. We want to talk with you and think through what the best options are for you. I'm very curious about some. I have a load of questions for you. But just know that we are there to help you, and we will be able to answer the questions without trying to sell you anything, without trying to pressure you into anything, because as I said, most likely you're talking to a counselor who's a volunteer, who has been doing this for a long time and knows their stuff, and it is able to talk insurance counseling with insurance people like your husband. Know the lingo. So,
Not a good choice.
yeah, I get you. That's fine. We do try our best to go, let's take a complicated topic and bring it down to a level that we can understand it. So, because it is a complicated topic. And in the end, to me, I go to work every day and I help people every day, and that's what I want to do. That's what our volunteers want to do, and that's what we're here to help you.
So before you do anything, you go online and get that Medicare number.
Right. We do tell people, that's why we say get out 3 months in front of it, is that we'll include that in, this is how you go about doing that, what you need to know. If you're after 65 and you're retiring, there's things you need to know that you have to get besides just telling Social Security, because then there's a document you have to get from your employer to show that you had creditable insurance. I mean, it gets weirdly, somebody will come up to me and say, oh, I'm 65, I'm still working, do I need to get Medicare? I can't answer that question until I start asking other questions. Like, oh, do you have an HSA account in your health insurance? Is your company less than 20 employees? Because that changes the answer. It's why it has to be this complicated, I don't know. That's good. Okay, sorry, I've just gone on here. If Brooke, anything about more about how they get appointments or so? I think we covered that. But
Yeah, call on the website is the absolute fastest way to get through to us, because that sends to us not quite instantaneous, but pretty quickly. We have a volunteer that runs that almost 24 hours a day.
Yeah.
So if you put that in, even at nighttime, it will be there first thing in the morning for us.
and you'll get a call.
But
Say,
you're
"Let's
also
set it
welcome
up."
to call or stop by the office and pick up a paper copy.
Yeah. So we'll hang around for any other questions or so. And Brooke, I think you have little things for people, little
Yeah,
little
I
gifts
have-
from S&P, from Senior Medicare Patrol.
They're actually